Welcome to this unit on trends in artificial intelligence in health. By the end of this unit, you will be able to summarize emerging trends in the use of AI in health. Emerging trends in the use of AI in clinical care. The use of AI in clinical care introduces important changes that extend beyond the provider-patient relationship. 4 emerging trends are the evolving role of the patient in clinical and primary care, the shift from hospital to home-based care, the use of AI to provide clinical care outside the formal health system, the use of AI for resource allocation and prioritization. Let's look at these trends in more detail. Evolving role of the patient in clinical care. AI could change how patients self-manage their own medical conditions, especially chronic diseases such as cardiovascular diseases, diabetes, and mental health problems. Although patients already take significant responsibility for their own care through taking medicines, improving their nutrition and diet, engaging in physical activity, and caring for wounds or delivering injections, AI could further support self-care by providing health information and guidance through health monitoring and risk prediction tools, chatbots, and technologies designed specifically for individuals with disabilities. The use of AI-enabled self-care tools invite additional considerations, including the degree of oversight exercised by a clinical team, tool-specific safeguards around the use of health data, patient knowledge of the implications of self-care tools for treatment effectiveness and personal data management. With chatbots in particular, it is often unclear to the end user how is data processed, stored, and retained. The terms and conditions for the platform hosting the chatbot, including the privacy policy or any other terms concerning patient data. For instance, some health organizations use chatbots in Facebook. While the recipient of the health data is primarily the health organization, Facebook has access to the chatbot conversations hosted on its platform. While a shift to patient-based care may be considered empowering and beneficial for some patients, others might find the additional responsibility stressful. It could also reduce an individual's access to formal healthcare services. The growing use of digital self-management technologies also raises wider questions of regulatory scrutiny, both in terms of the nature and quality of advice given and the safeguards for patient data. Clinical applications require greater regulatory scrutiny, while wellness applications require less or even no regulatory scrutiny. Many digital self-management technologies fall into a gray zone between these two categories. They may present a risk if they are used by patients for their own clinical care, as they remain largely unregulated and could be used without prior medical advice. Such concerns are exacerbated by the distribution of applications by entities outside of the formal healthcare system. For example, in the USA, the Health Insurance Portability and Accountability Act, HIPAA, sets regulatory standards for the lawful use and disclosure of health information. However, HIPAA only applies to covered entities, namely healthcare providers and their business associates. That means that not all entities that purport to provide medical services are covered by HIPAA, hence they do not have the same level of obligations with regard to the processing of health data. Shift from hospital to home-based care. Telemedicine is part of a larger shift from hospital-based care to home-based care, which has accelerated since the start of the COVID-19 pandemic. AI technologies are being used to facilitate this shift through remote monitoring systems such as video-observed therapy for tuberculosis, virtual assistants to support patient care, AI technologies may also play a more active role in the management of patients' health outside clinical settings, such as in just-in-time adaptive interventions. These rely on sensors to provide patients with specific interventions according to data collected. They also notify a healthcare provider of any emerging concern. The growth and use of sensors and wearables may improve the effectiveness of just-in-time adaptive interventions, but also raise human rights and ethical concerns in terms of the amount of data technologies collect, how data is used, and the burden these technologies may shift to patients. AI for clinical care outside the formal health system. AI applications in health are no longer exclusively used in healthcare systems. As AI technologies for health can be acquired and used by non-health system entities, people can obtain healthcare services outside the healthcare system. For example, AI applications for mental health are often provided through the education system, workplaces, and social media. The trend of self-management has also increased the use of AI-guided mobile health applications and wearables. Wearable technologies include those placed in the body, such as artificial limbs and smart implants, on the body, such as insulin pump patches and electroencephalogram devices, or near the body, such as activity trackers, smartwatches, and smart glasses. Wearables create more opportunities to monitor a person's health and to capture more data to predict health risks. However, monitoring of healthy individuals raises concerns, as it permits near constant surveillance and collection of excessive data. This data collection contributes to the ever-growing practice of biosurveillance, which also poses significant human rights, ethical and legal concerns. AI for resource allocation and prioritization. The fourth trend is the use of AI to assist in decision-making about prioritization or allocation of scarce healthcare resources. Although prognostic scoring systems have long been available in critical care units, the attraction of this use of AI has grown due to the COVID-19 pandemic, where many institutions lacked bed capacity and others had inadequate ventilators. Machine learning is a form of AI that uses algorithms and data to automatically learn and adapt with or without human intervention or instruction. It has been suggested that machine learning algorithms could be trained and used to assist in decisions to ration supplies, identifying which individuals should receive critical care, identifying when to discontinue certain interventions, especially ventilator support. AI tools could also be used to guide allocation of other scarce health resources, such as, for example, newly approved vaccines during the COVID-19 pandemic, for which there was an insufficient initial supply. You have now completed Unit 2 of Module 1, Applications of Artificial Intelligence for Health. In the next unit, we will look at AI in health research and drug development.